In the OET speaking test, you only have 3 minutes preparation time, which isn't a lot of time. You need to make sure you're using that effectively. Hi, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Partners, so you are in the perfect place for your OET. In this video, I'm going to show you what you need to do in the preparation time, what you need to think about so that you can do a great role play. Don't forget to stay to the end of the video. We've got a free handout for you. Let's go. First, let's look at what happens in the OET speaking test. First of all, there's a warm-up section, and this is about 3 to 4 minutes long, and you're not assessed on this. Then you get given a role card, and you have some preparation time to read through the role card, 2 to 3 minutes. And then you complete the role play, which is a consultation with the patient or carer, and this lasts about 5 minutes. You then get given another role card and do the same again. This week's video is sponsored by Talent Find. Talent Find is built specifically for health and care professionals, making it easier to manage your career with confidence. With Talent Find, you get a personalised portal with secure document storage and a digital career passport to showcase your education, skills and experience. You can instantly check your eligibility to work anywhere in the world, get accurate job recommendations, and receive expert career guidance to support transitions into new roles. Talent Find also gives you access to accredited language training, upskilling and e-learning opportunities. Looking to find work abroad or a sponsored role? Talent Find connects you with global jobs, fellowships, placements, and exchange programs, along with visa and credentialing support. Best of all, it's part of a global health workforce community, giving you one ethical, trusted place to manage your health or social care career. Sign up for your free Talent Find account today. The link's in the description. The speaking test is based on typical workplace situations, and you will always be a doctor. You need to ask questions and give information, and you're assessed on 2 sets of criteria. We have the linguistic criteria and the clinical communication criteria, both available on the OET website. So how should you approach the OET speaking test? Let's take a look. Step 1. Look at the setting. Find out who you are and who you're going to talk to. Step 2. Read any background information, such as the main medical issue, previous treatment, or an indication of how the patient is feeling. Step 3. Look at the tasks and underline the function verbs, such as explain, reassure, give advice. Step 4. Use the information given and the tasks to predict how the conversation might flow. And step 5, brainstorm useful language for each of the tasks and think about how to begin the role play. Remember, if you are unsure about anything, you can ask the interlocutor any questions. And you can also underline words and make notes on the role card. So let's take a look at a role card and how we can think about those questions. So pause the video and read through the role card now. So we can notice the setting is in a medical clinic, and here we have information about the patient. And then you have the tasks. It's a good idea to underline the task verbs. That way you won't miss any out, particularly if there are lots of tasks within one point, such as here in task 4. It just helps you focus. So make sure you use these 3 minutes effectively. There are lots of things to think about during the preparation time. Let's take a look at some things to consider now. First, how are you going to start? Think about where you might need to demonstrate empathy. These relate to the relationship building criterion. Where can you elicit or explore concerns? And how do you expect the patient to react? This will help you fulfill the criterion of exploring the patient's perspective. And think about what signposting phrases you could use. This will help with providing structure. What questions could you ask, and where might you need to find out what the patient already knows? This will ensure you get high marks in information gathering. And then finally, where are you going to pause and encourage the patient to respond? And what functional language could you use? This will help fulfill the information giving criterion. Before we continue, make sure you check out our OET course for medicine, packed full of speaking tips, language, and example tasks to help you pass the OET exam. Links below. Let's take a look at all those questions relating to the role card we looked at. Relationship building. So here we can see the first task is find out the reason for the patient's visit. So it would be logical to begin the role play like this. Good morning, I'm Dr. King. Can you tell me what brings you here today? We can then think about how and where we might need to demonstrate empathy throughout the role play. So if we look at the second task, the patient might explain that they're in pain. So we could empathize with that. Sorry to hear that. It's understandable you're in a bit of pain. And in the last task, the patient might be reluctant to return to exercise classes. So we can empathize with that by saying, I understand you might not be keen to return to the classes, but there are lots of benefits. Exploring the patient's perspective. In the OET roleplay, you need to explore concerns, even if it's not on the role card. So we might explore concerns here and say, is there anything specific you are worried about? Or perhaps in the last task, if they're reluctant to continue the exercise classes, we might ask, why? What concerns you about continuing the exercise classes? We can also notice how the patient is likely to react. Here we have recommend 1 week off exercise, stress the importance of rest from exercise, and then emphasize the benefits of exercise classes. So we can sort of work out that the patient might first be reluctant to stop the exercising and then perhaps be worried about starting them up again. Providing structure. It's important to use signposting phrases before any explanations to signal what you're about to talk about. So, in the second task, we might signpost by asking if it's okay to ask some questions first. I'd just like to ask you some questions about your back, if that's okay. Then in the third task, where it says advise on next steps, we can signpost that we're going to do this by saying something like, let me explain what we're going to do now. And in the next task, where we have make further recommendations, we can signpost we're about to do this by saying, I'll explain some things you can do to manage your pain. Information gathering. It's important to think about the type of questions you might ask. And remember to start with open questions, such as, would you mind telling me a bit more about your symptoms? Followed by closed questions as necessary, such as, where exactly is the pain? Do you have any idea what might have caused it? And we might want to find out what the patient already knows about a medical condition or perhaps a procedure. So in this role play, we might ask, have you heard of muscle strain before we give the diagnosis? Information giving. During the preparation time, it's important to think about where you're going to pause and encourage the patient to respond. You don't want to keep talking for too long without stopping. So if we look at task 3, there's actually a lot of information we're going to be giving. So it would be a good idea to pause here, here, and here. And then we would encourage the patient to respond at the end by saying something like, how does that sound? We can also think about functional language to use for specific tasks, such as here, where it says, make further recommendations. We want to use functional language for giving advice, such as, it's a good idea to use a heat pack or ice pack to help reduce any pain. You should also take paracetamol and acetaminophen if you have a lot of pain. And don't forget to check at the end. Do you think you'll be able to manage that? Here I have 3 of the tasks from the role card we've just looked at. I'd like you to pause the video now and choose the most appropriate phrase to express the task A or B for each one. Okay, let's take a look. Make sure you use appropriate language. For the first one, A is more appropriate. We need to use open questions first and avoid compound questions, such as we see in option B. For stress the importance, we shouldn't be too direct by using phrases such as you must, you have to. Instead, use polite but firm language as needed. And for establish patient's consent, we should gain consent by asking permission. Avoid just telling the patient what you're going to do. So what can you do in your self-study to improve OET speaking? Let me give you a few tips now. Build up a bank of useful phrases for common verbs. Revisit these phrases regularly and practice using them in different contexts. Get together with a friend or colleague and practice the speaking role plays which are available on the OET website. Why not record the interaction, then analyse how well you performed? Decide together if you used the right language for the task. What aspects did you perform well and what aspects could be improved? Then repeat the same task, but better. And practice explaining medical conditions, medical treatment, or how to manage a condition. Over to you. I want you to imagine I'm your patient and I'm really worried about some symptoms I'm having. And I say to you, oh, I'm really worried it might be something serious. How could you respond to this using empathy? Let me know in the comments below. And now that you've come to the end of today's video, we've got a free handout for you. Simply write medicine in the comments below and we'll send you the link. And if you want more phrases for OET speaking, why not check out our other video here. See you next time. Bye. In the OET speaking test, you only have 3 minutes preparation time before you do the role play. This isn't a lot of time to do all the things you need to think about. There are lots of things to consider. Let's take a look at those questions. I'm really worried that it might be something serious. How would you respond to this phrase? No, 1 second. And if you want more... Woo!